Assalamualaikum. I hope you all have joined. So let me check how many of you are active viewer. So those who are active viewer, I request all of you to write yes in the chat box. So those who are listening to me, just write yes in the chat box. Okay, Dabir has joined, Rifat, Pavaskar joined. Very good. Sakib seems to be active, yes. What about others? Yes, very good. Nice. Till now only 21 students are active. I want more students to be active. I can see only 21 chat is there. Okay. Very good. Afreen, Hana, Khan Aisha, Afroza Burkar, Ruksar Kanikar, Zareen, Raunak, Hawa. Okay, fine. But still 29 students are active. I want all 60 students to be active. Okay, good. So good to go. So Assalamu alaikum and good morning to one and all. Today we'll start with new chapter, that is anti-psychotic drugs. I am Professor Sheikh Abu Sufyan. Welcome you to AS Academy Learning Forever. At the end of this e-learning session, you are able to discuss incident, clinical and characteristic features of psychosis and explain its neurochemical theories. That is very important in order to understand pharmacotherapy of the psychosis. So let's start with the incident of the psychosis. What is the prevalence and how it changed from population to population. So about the incident, the psychosis, its effect about 1% of the population. So out of 100, maybe 1% he may be suffering from the psychosis. So the prevalence, it is very less, but although the prevalence it is very less, but it is one of the most important form of psychiatric illness. We'll see what is the reason why it is one of the most important form of psychiatric illness. So there are many psychiatric illness like depression, mania, psychosis, right? So out of these illness, the psychosis, it is one of the most important form of psychiatric illness. So let's see what is the reason behind the reason for which it is important psychiatric illness. So the first reason is it affects the young people. And remember that the young population, it is the backbone of any nation. And any disease which affect the young population, that disease it is very important and need to be addressed urgently. Okay, so first reason it affect young people. Second reason, it is chronic in nature. It means for the treatment of psychosis, you need long-term treatment. Just the treatment for a day or two or maybe for the week or a month, it is not sufficient for the complete improvement of the psychiatric patient. You need to give the chronic treatment. And third thing, it is usually highly disabling in nature. Since it is highly disabling, it completely affects the normal life of that patient. The normal life of that patient, his relatives and his family, it is affected due to psychosis. And this is the reason why psychosis, it is one of the most important form of the psychiatric illness. Let's see what are the clinical features of the psychosis. So the clinical feature of the psychosis, it is divided into two parts. First, it is positive and second one, it is the negative symptom. So anything which is above the normal, for example, this is the normal range of the symptom. So anything which is above the normal, it is called as a positive, and anything which is below the normal behavior, that is called as the negative. So let's see what are the different positive and negative clinical symptom of the psychosis. Based on this symptom, you can identify the type of psychosis or type of schizophrenia, whether it is positive or negative in nature, and depending upon that, you can give appropriate medicine for the treatment of this kind of psychosis. So first it is positive syndrome. So positive means the symptom or the behavior which is abnormal, which is something aggressive, or which is not a normal, which is abnormal. It is called as the positive symptom. So first symptom, it is the delusion. So delusion, it means there is false belief. So there are many patients who have the belief which are realistic in nature, but psychiatric patients, they having the false belief. They always thought in wrong way, they always think in the wrong way, that this has happened due to this reason. So I did this, so this happened. Okay. So this type of false belief are there. So if this is the symptom, then it is the positive symptom of the psychosis. Next symptom, it is the hallucination. So hallucination, these are the false perception. So feeling of things which are not actually exist. Okay. So the hallucination in case of psychosis, it is usually in the form of the voice. So the patient suffering from positive symptom of psychosis, so they feel or they have the perception of the sound or the voice which generally not heard by the normal patient, or sometimes these are often exhortatory in their message. For example, in case of the ticking sound of the clock, like the clock gives clicking sound like tick tick tick. So this is the ticking sound of the clock. So this ticking sound of the clock, it may not disturb normal patient, but if patient suffering from the psychosis, even he having this, if he having the positive symptom, then even the ticking sound of the clock, it may be quite disturbing to him, and he will try to run away from that particular sound. So generally this sound, it is the normal sound which actually should not affect to the normal patient. But if patient suffering from the hallucination, since he feel the perceptions of things which are not exist, or they are exhortatory in nature, means if the less sound is there, he feel more sound, isn't it? So that is called as hallucination. Third symptom, it is the thought disorder. So it comprises of wild train of thought. So very wild thought. So generally which is not normal. And since he has coming or he has getting this wild train of thought, whatever decision he take, it is not a proper, and he will conclude in irrational way. So it result in irrational conclusion. The reason is that because he having the wild train of thought, and due to this wild train of thought, he will conclude in irrational way. So he will not able to take appropriate decision. His conclusion are always wrong because his thought process, it is wrong. The thoughts always coming are the negative, which are abnormal in nature, and as a result of that, he will take the wrong decision due to irrational conclusion. Next symptom, it is abnormal behavior such as stereotype behavior. So we have seen in case of convulsion, in case of psychomotor convulsion, the patient show this type of stereotypic behavior where he move from one place to another place, right? So he is moving from left to right, sometimes right to left, going forward, coming backward. So this repetitive movement, it is there, right? Likewise, we have seen the hair combing. So the female, they keep on combing the hair. So that is stereotypic behavior. So this abnormal behavior also observed in case of the patient if he having the positive symptom, and occasionally there is aggressive behavior to the extent he will start shouting and even punishing to his love or his near and dear one, isn't it? So all these symptoms which are abnormal, like the delusion, hallucination, thought disorder and abnormal behavior, they are fall under positive symptom of psychosis. Let's see the second category of the symptom, that is the negative symptom. So the negative symptom, which is something which is below the normal, right? For example, withdrawal from social contact. So if you are coming in contact with your friend, what you will do? Like in classroom also, if the teacher is not there, so humanity is the social animal, right? So he will start socializing, he will start talking with your friend. So you will start talking with your friend. Likewise, if you are in a family and 4 or 5 members of your family sitting with you, you will start talking with them, you will ask them the question, or maybe you can start sharing the information. But if patient suffering from the psychosis, he will be completely withdraw himself from the social contact, right? So this is something which is the below normal behavior. So it is one of the negative symptom of the psychosis. Second symptom, it is the flattering of emotional responses. Like suppose if someone is giving you a gift, what will be your emotional response? You will be happy, or sometimes you become euphoric, means there is feeling of great happiness, right? But in psychiatric patient, no matter which gift you are giving, or no matter how much happiness you are giving to the psychiatric patient, but he is always sad. Likewise, if sad event it is happen in the home, like someone in his family died, or very near and dear one of his family he is died, so he will not cry because there is complete flattening of emotional response. It is occur in case of negative symptom of the psychosis. So this is in case of the flattening of emotional responses. Third symptom which is seen as a negative symptom, it is deficient in cognitive function. So cognitive is something which is related to the learning and memory. So there are two important things in case of the learning. First one, it is the attention. So the patient should able to attend, or he should able to maintain proper concentration, but that is not happen. So this attention it is affected, and also its memory it is affected, and it may lead to affect its normal learning behavior, right? So these two symptoms, that is attention and loss of the memory, together with the anxiety and depression, it is also one of the negative symptom of the psychosis. So due to all these symptoms, that is positive symptom and negative symptoms, so it's depend. In some patients they only have positive symptom, some patients they only have negative symptom, and in some patients they having both positive as well as negative symptom. So due to all these symptoms, that patient get frustrated, right? And he lose all hope of his life. And when that stage come, some of those patients they do the suicide. So in about 10% of the patients suffering from psychosis, it is seen that they do the suicide, and there is death of the patient. It is occurred due to the suicidal incidences. Okay, so these are all the clinical manifestation of the psychosis. Let's see about the characteristic feature of the psychosis. So there are two important characteristic feature of the psychosis. First, it is defect in selective attention. So I will give few example and try to explain you what do you mean by selective attention. And second, it is the latent inhibition. So first is the selective attention. Just a minute. Okay, so first behavior, it is the selective attention. So in selective attention, it is basically ability of the schizophrenic patient to discriminate between significant and insignificant stimulus. Okay, so generally in case of normal patient, the normal patient will respond to significant stimulant, okay, and he will not respond to the insignificant stimulant. For example, if there is some relevant information is there, or your friend sharing relevant information with you, what you will do? You will give your 100% attention because your friend is giving relevant information to you, right? Likewise, if your friend is sharing very irrelevant information, what you will do? You will start ignoring that friend, because always whenever he sit with you, he always give you irrelevant information. Okay, so the selective attention, it is that is in case of the relevant information, it is the behavior of the normal patient. But if this is disturbed, like for example, if your friend is giving irrelevant information and that patient is that person or that student is listening to him, right? Whereas when he is giving very relevant information, he is not listening to him. So what that indicate? This indicate that the patient's selective attention, it is disturbed. So he don't able to discriminate between significant and insignificant stimulant. He don't know in which thing he has benefit and in which thing he do not have benefit. So sometimes he is attending the case where he do not have benefit, and something he is ignoring the things where he has the benefit, right? For example, teacher asking you to listen to the session, and you are actually listening to the session because it is relevant information. It is something which is related to your career, that indicate that this is the normal behavior. Now the lecture is going on and teacher is giving the relevant information, but you are not listening to that relevant information. Instead of that, you are doing something else which is not relevant at this moment. So this again indicate that there is abnormal behavior. So you are not able to discriminate in between the normal and abnormal behavior. So this is one of the important symptom of the psychosis. So let's see about the second symptoms or second characteristic feature of the psychosis, that is the latent inhibition. So first we have seen that is the selective attention. Second one, it is the latent inhibition. So we'll try to understand latent inhibition by studying one of the animal model, and there is the one test in animal model that is called as the bar press test. So what you are doing in case of bar press test, you are keeping animal into the chamber of bar press test and you are giving conditional stimulus. What is the conditional stimulus? So there is the bell, there is a sound, followed by that bell there is unconditional stimulus. So that is unfavorable stimulus like foot shock, right? And this animal, whenever he get bell, after the bell followed by bell there is unconditional stimulus like foot shock, right? And he will get the relief from foot shock when that animal press the bar, isn't it? So what happens when you give the training to the animal? At initial level he don't understand what is happening, right? But after some time, if that animal is normal, he will learn to press the bar. So immediately after conditional stimulus, that is favorable stimulus like sound or the beef, or what he will do, he will immediately go and press the bar to avoid the foot shock, isn't it? So this is in case of the normal animal. But if you are giving some drug to induce psychosis in that particular animal, then what will happen? He will, whatever his learning was there, maybe he has learned initially to press the bar to avoid this foot shock, because he learned that after the bell immediately he will get the foot shock. So to avoid that, after the bell, instead of waiting for foot shock, he will immediately go and press the bar. So that animal will go and press the bar. But if you have given the drug which induces the psychosis, then in such case, that animal, although he heard the sound but will not press the bar, he don't understand, he will confuse, that animal will confuse, and it is something like that animal is happily taking the foot shock without pressing the bar. If that is the case, that indicate the behavior called as the latent inhibition, isn't it? So something which is insignificant to that patient, but he is happily tolerating that insignificant stimulus. Okay, so that animal is happily taking the foot shock, not pressing the bar. So this indicates there is a latent inhibition. So if you ask the patient, your benefit, or you are a student, and I am telling you your benefit, it is in the listening this session, isn't it? And give your 100% attention. But in case of psychotic patient, he will not able to concentrate. He don't know what is benefiting to him and what is not benefiting to him, and as a result of that, he will show behavior called as latent inhibition. So wherever benefit is there, he will not able to take that benefit, or suppose if there is opportunity to that particular person, he will not able to grab that particular opportunity. So that indicate the behavior, it is the latent inhibition. So these are two important behavior, that is selective attention and latent inhibition, are the characteristic features of the psychosis. Let's try to understand with some example and evidences. So it is often impaired in case of schizophrenic patient. So animal which is treated with the amphetamine, so the amphetamine or other psychomimetic drug which actually produce the psychiatric action, or they produce as the psychosis, so you call it as a psychotomimetic drugs. Okay, so one is the amphetamine and other it is lysergic acid diethylamide. So when you are giving this drug to the patient or to the animal, it produces the psychiatric behavior. So there is the complete latent inhibition is seen when patient is given with the amphetamine or lysergic acid diethylamide. Or when you give this drug to the animal, although initially he has learned to press the bar to avoid the shock, but after giving this drug, since he is suffering from latent inhibition, that animal will not press the bar to avoid the food shock. Okay, so what that indicate, the amphetamine and lysergic acid diethylamine are psychotomimetic drugs. They are able to produce the important characteristic feature of psychosis, that is latent inhibition. Likewise, when you give anti-psychotic drugs, so when you give the anti-psychotic drug in the same animal, you can see there is this behavior, it is restored. Means earlier when he was pressing the bar, so when you have given the amphetamine, you have given the lysergic acid, the moment when you have given this drug, that animal will not press the bar. He will take the shock, right? But when you give antipsychotic drug, since it produces antipsychotic action, that animal will immediately press the bar. That indicate that the latent inhibition, so whatever this behavior which was inhibited, was restored by antipsychotic drug. Okay, so this is again very interesting characteristic feature of the psychosis. Now we'll see about neurochemical theories. So it is very important because you want to target your medicine on the central nervous system and whichever neurotransmitter which is affected due to psychosis. So the neurochemical theory, there are sufficient evidences which suggest that the increase in level of the dopamine, it may lead to psychosis, whereas in case of the glutamate, there is decrease in level of psychosis, decrease in level of the glutamate, it produces the symptom of the psychosis. And in case of 5-HT, the increase in level of the 5-HT, it may produces the psychosis in the patient. Okay, so increase in level of the dopamine, decrease in level of the glutamate, and increase in level of the 5-HT, it produces the psychosis. So all these theory, it is based on the evidences. So let's see the first theory, that is the dopamine theory. So what dopamine theory indicate? Increase in level of the dopamine in the brain, it produces the psychosis. Let's see what are the evidences. So in the animal model, when you give the amphetamine release dopamine in the brain. Okay, since it releases the dopamine in the brain, it is observed that it produces behavioral symptoms which are similar to the schizophrenia or the psychosis. So schizophrenia, it is synonym to the psychosis. So since amphetamine, it releases the dopamine, and after giving amphetamine, that patient or that animal to whom the drug is given, it will start showing behavioral syndrome of the psychosis or the schizophrenia. So it clearly indicates that increase in level of dopamine might be responsible for the psychosis. Likewise, in animal model, the dopamine release causes specific pattern of stereotype behavioral, which is resemble with the schizophrenic patient. So again, any drug which produces the release of the dopamine, since it causes the stereotypic behavior, so this is one more evidence in support of dopaminergic theory. So increase in level of the dopamine produces the psychosis. Likewise, when you give potent D2 receptor agonists, so what D2 receptor agonists are doing? They are not increasing level of the dopamine, but they bind to the dopamine receptor and activate it, isn't it? So either you can increase the level of the dopamine or you can activate the dopaminergic receptor, because dopamine also bind to the dopaminergic receptor and activate it and produces the psychosis psychiatric symptom. So likewise, potent D2 receptor agonist like apomorphine and bromocriptine, it also produces the symptom which are similar to the psychosis, isn't it? So these all evidences, it suggests that increase in level of dopamine, it produces the psychosis. So we have seen when we give the amphetamine which releases the dopamine, it produces the psychiatric symptoms. Likewise, increase all drugs which releases the dopamine in the brain, it produces the stereotypic behavior. And D2 receptor agonists like apomorphine, it produces the psychiatric symptom that indicate that the increase in level of dopamine, it's play a very important role in case of psychosis. So if you want to give the treatment, you need to normalize the increase in level of dopamine so that you cannot see the positive and negative symptom of the psychosis. Likewise, second neurotransmitter which play very important role in psychosis, it is the glutamate. So we call it as the glutamate theory. So what we have seen, decrease in level of the glutamate, it may produce the psychosis. So this was the assumption. So let's see what are the evidences. So when glutamate receptor antagonist, so what glutamate receptor antagonist they are doing, or they bind to the glutamate receptor and deactivate it. So remember that the agonistic drug, when bind to the receptor, they activate, whereas antagonist drug, when they bind to the receptor, what they are doing, they deactivate this receptor. Okay, so they are deactivating this receptor. Since glutamate receptor antagonist like phencyclidine, ketamine and diazoxypline, what they are doing, it produces the psychotic symptoms. Okay, so it produces psychotic symptoms, like they produces the hallucination and thought disorder in a human, which are generally the positive symptom of the psychosis. So this indicate that deactivation of dopamine receptor or deactivation of glutamate receptor or decrease in level of the glutamate, it is one of the neurotransmitter in the brain, it may be responsible for the psychosis. Also, the reduced glutamate concentration and glutamate receptor density in the brain, it is observed in case of psychiatric patient. So in case of post-mortem brain of patients suffering from the psychosis, it was observed that there is reduced in level of glutamate concentration and also the glutamate receptor density. So this clearly indicate that the glutamate also play a very important role in case of the psychosis. Likewise, other theory including the 5-HT and noradrenaline theory. So in case of 5-HT and noradrenaline theory, let's see how it affects the psychosis. So the one of the evidence that is in case of the LSD, that is lysergic acid diethylamine. So when LSD it is given, so LSD it is 5-HT receptor agonist. So what this LSD will do, it will activate the 5-HT receptor. Okay, so these are the drug which activating the 5-HT receptor. So the any drug when it bind to the 5-HT receptor and it activate it, it is observed that it produces schizophrenia like symptoms. So what this indicate? So drug binding to the receptor, 5-HT receptor and produces schizophrenia like symptom. It means the increase in level of 5-HT, it may be responsible for the psychosis. Let's see one more evidence. So when you give antipsychotic drug, it is observed that the many antipsychotic drug, what they produces antagonistic action on 5-HT receptor. Okay, so what they are doing, they are deactivating. So when they deactivate the 5-HT receptor, it is observed that this drug can produces antipsychotic action. Whereas agonistic drug, when they activate this receptor, they produces the symptom of the psychosis. Okay, so the agonistic drug, they produces the psychosis, whereas antagonistic drug, they produces the antipsychotic action. So this clearly indicate that increase in level of the 5-HT might be responsible for the psychosis. Okay, so we have seen in case of the neurotransmitter theory or neurochemical theory, we have seen there are three neurochemicals are disturbed. First one, it is the dopamine. An increase in level of dopamine, it is responsible for the psychosis. Second, we have seen the glutamate. Decrease in level of the glutamate, it is responsible for psychosis. Likewise, in case of the 5-HT, increase in level of the 5-HT, it is responsible for the psychosis. So let's do quick revision of this session through question and answer. So my first question is, among following symptoms, identify negative symptom of the psychosis. So first symptom, it is hallucination, delusion, deficit in cognitive function. So amongst this symptom, you tell me which one is negative symptom of the psychosis. Write in a chat box. So Zareen saying it is deficit, so deficit in cognitive function. Okay. Saqib, he says it is deficit in cognitive function. Okay. So Gajanan, Tuba, Nida Mansuri, Nurun Nisa, Rahul, Zareen, all of you have given the answer, that is deficit in the cognitive function. So you are right. So hallucination and delusion, these are the positive symptoms of the psychosis, whereas deficit in the cognitive function, it is the negative symptom of the psychosis. My next question, enlist two important characteristic features of psychosis. What are the two important characteristic features of psychosis? So Zareen saying it is selective attention and it is latent inhibition. Selective attention. Roman, Tuba, Karbari saying selective attention and latent inhibition. Yes, very good. Dabir, Kavita, Rifat Pawar. Yes, right. So selective attention, so there is the patient unable to discriminate between significant and insignificant response. Likewise, the relevant and irrelevant stimulus. So that is the selective attention. And second one, it is latent inhibition, where although he having the idea that after the sound there will be the foot shock, but that animal will not able to press the bar to avoid the foot shock. Very good. So correct answer, the selective attention and latent inhibition. So these are the two important characteristic feature of psychosis. It means sometimes see the positive and negative symptom, it might be seen in the patient sometime due to some incidences, right? But if patient start showing these two features, that is selective attention and latent inhibition, so now it is confirmed that that patient is suffering from the psychosis. So when you go to the psychiatric or when you are taking that patient to the psychiatric, the physician, he will start asking number of the question to confirm that these are two behavior are seen in that patient, that is selective attention and latent inhibition. So once we confirm those two characteristic feature of the psychosis, now he will start giving the treatment for the psychosis. Or otherwise, if the psychosis it is incidental in nature, right, maybe due to some incident, if there is some death in the family, so some patient take the shock and suffer from the psychosis, then in those cases there are only positive symptom or negative symptom, then accordingly proper treatment can be provided to that particular patient. Now my third question is, give one evidence which suggests that increase in level of dopamine may be responsible for the psychosis. So we have seen 2-3 evidences with the example of drug. You just give me one evidence which suggests that increase in level of dopamine may be responsible for the psychosis. Yes. So Tuba given the answer amphetamine. So what amphetamine does? Amphetamine releases the dopamine in the brain, and since the level of dopamine it is increased, the patient show the symptom of the psychosis. Very good. So increase in level of the dopamine. Likewise, dopamine receptor agonist like apomorphine also produces the symptom which is similar to the psychosis. Right answer. So the Saif Ali, Afroza, Raunak Khan, Shaheen Khan, Zareen, Tikra Hussain. So you have given the right answer. That is the when amphetamine it is given, since it releases the releases the dopamine in the brain, so that indicate that increase in level of dopamine may be responsible for the psychosis. My next question: phencyclidine produces psychiatric syndrome. So when phencyclidine it is given either to the animal or to the human being, it produces the psychiatric syndrome. Identify neurotransmitter altered by the phencyclidine to produce this symptom. So in short, which neurotransmitter it is altered by the phencyclidine and that may lead to the psychiatric symptoms or that may lead to the psychosis. So Dabil saying glutamate, Saki says glutamate. Okay, Sahir Bano, Saif Ali, Ansari Farzeen, Shaista, Shagufta Shah, Rahul Gupta. Okay, so it actually altered the glutamate. So phencyclidine it is glutamate receptor antagonist. So what it does, it deactivates the glutamate receptor. So what glutamate theory says, either decrease in level of the glutamate or deactivation of the glutamate receptor, it is responsible for the psychosis. So we have done with today's session. So to summarize, we have seen the psychosis, it is a very important form of the psychiatric illness. It in case of the clinical manifestation, it shows two types of symptom, that is positive symptom which is abnormal in nature like hallucination, then delusion, and your stereotype behavior and aggressive behavior. These are the symptom of the positive, or these are the positive symptom of the psychosis. Likewise, patients show negative symptom like flattening of emotional responses, isolation from the social contact. So social contact is isolated. So these are the negative symptom. Likewise, deficit in the memory and patients suffering from the anxiety and the depression. So that indicate that these are the negative symptom of the psychosis. Then we have seen the two important characteristic feature of the psychosis, that is the selective attention and the latent inhibition. So if these two features are seen in the patient, that clearly indicate that patient is suffering from the psychosis or the schizophrenia. Okay. After that, we have studied the theory of the psychosis. So we have seen the first theory of psychosis, that is the dopamine theory, that indicate increasing level of dopamine or activation of the dopamine receptor might be responsible for the psychosis. Likewise, we have seen second theory, that is the glutamate theory, where we have studied decrease in level of the glutamate or deactivation of glutamate receptor might be responsible for the psychosis. And third theory we have studied was 5-HT theory, where we have seen that increase in level of the 5-HT it produces the psychosis, and if the drug it antagonizes the 5-HT receptor, those drugs can produce as antipsychotic action, right? So in next lecture we'll see how we can correct this problem of the psychosis so that the patient abnormal behavior become normal, and you can provide pharmacotherapy for the patient suffering from the psychosis or the schizophrenia. So I have done with my session, so I will be releasing attendance sheet soon. So thanks for watching the session. If you like my session, then do remember to give me a thumbs up. So thank you very much. So I'm releasing attendance link in the chat box. So once you give the attendance, say done, and then you can leave the class.